Lateral trunk bending is the patient bend trunk laterally, placing COG over base of support. This happens during mid-stance. It may be caused from the patient or orthosis. Possible cause is weak hip abductors contracture, hip dislocation, hip pain, poor balance, short leg on the affected side, or patient requires a walking aid or cane.
During stance phase on the lateral trunk bending, we can observe that the trunk is bending towards the side of the supporting limb. We can observe this gait from the coronal plane.
Hip hiking gait. It happens during swing pace when foot not contact ground and is acting like a double pendulum. The patient will be elevate the pelvis on affected side. Hip hiking lengthens the stride of affected side since it permits greater rotation of the pelvis in transverse plane. It may helping to increase pendulum movement. The possible causes: equinus deformity or ankle dorsiflexor weakness, skeletal shortening on some side, and it may be combined with circumduction in order to give additional anterior movement to the flexion impaired hip joint.
During swing pace on hip hiking gait, it happens excessive elevation of pelvis on the affected side. We can observe this gait from the frontal or coronal plane.
Excessive hip rotation. It happens during swing and stand pace. It can be observed in front or behind of the patient. There is exaggerated like internal or external rotation of the entire limb. The possible causes: muscle imbalance, muscle weakness, spasticity, foot deformities, uneven ground contact causes turning moment in the foot which are transmitted to the entire leg, or maybe because footwear or orthosis.
During stance pace in hip internal rotation, the thigh is twisting inward from hip joint. We can observe this gait from the coronal plane. During stance phase on the hip external rotation, we can observe that on the right side of the limb, the thigh is twisting outward from the hip joint. We can observe this gait from the coronal plane.
Genu valgum is the excessive tibia abduction, reverse to lateral deviation of the distal tibia from center of the knee which is less than normal, approximately 10 degrees of the angle between femur and the tibia. During standing, the distance between the feet is greater than at the knee. And the possible causes: loss of structural integrity of the knee, medial lateral hamstring or quadricep power imbalance, calcaneus valgus, or maybe because tibial or femoral shaft malalignment. Genu varum is the excessive tibial adduction. During standing, the distance between the feet is lesser than at the knee. The possible causes: loss of structural integrity of the knee, medial lateral hamstring or quadricep power imbalance, calcaneovarus, or tibial or femoral shaft malalignment.
During stance phase on genu valgum, the knees push in towards each other. We can observe this gait from the coronal plane. During stand phase on genu valgum, it happens excessive adduction on the tibial. Besides that, the distance between the feet is lesser than the knees.
Medial foot contact is when the patient bears excessive weight on the medial border of the foot at any time during stand phase. The possible causes is inverter's weakness or everter spasticity, pes valgus, or excessive genu valgum.
During stand phase on the medial foot contact, we can observe that on the left side of the foot, the medial of the foot is touching to the ground. We can observe it from the coronal plane.